Communication is the imparting or exchange of information by speaking, writing, or use of another medium. Pharmacists communicate with patients, their carers, and other healthcare professionals on a daily basis. It's one of the most important skills you will use. Face-to-face communication is the most common form in a pharmacy setting. However, we also often communicate on the phone, with doctors or patients, or through writing, for example through emails or medication labels. Communication is a two-way process. The sender conveys a message to the receiver, who usually responds with some sort of feedback about the message that has been received. The message itself is made up of three main components: verbal, non-verbal, and body language. Verbal refers to the actual words or language being used. Avoid any medical jargon with patients. Use vocabulary that is easy to understand. For example, stomach pain instead of gastrointestinal discomfort. Non-verbal refers to the way you say the words. The pitch, volume, accent, tone, and speed of the voice can change a message entirely. For example, a raised voice versus a gentle tone. Messages can also be delivered via body language in face-to-face interactions. Making good eye contact, offering a firm handshake where appropriate, avoiding barriers such as folded arms or speaking to somebody across a counter, as well as using appropriate facial expressions and posture, all adds to the message being delivered. Feedback from the receiver is vital for effective communication because it confirms that the message has been received correctly and is understood. When communicating with a patient, questioning must be conducted in a structured way, perhaps using a guideline such as WHAM. Who is the patient, what are the symptoms, etc. To make sure that no information is missed, listening must be active. This means concentrating on what is being said, processing the information, and refraining from interrupting the person who's speaking. Finally, any explanations to patients must be long enough to cover the main points, but short enough to hold the patient's attention. As a pharmacist, professionalism should play an integral role in all of your communications. A professional appearance, such as being dressed appropriately for a healthcare setting. Professional behaviour, such as manners, respect, and empathy for the patient. And professional competence, offering concise and reliable information, all instills trust in the patient and enhances the communication process. In summary, communication is the imparting or exchange of information, a two-way process between a sender and a receiver. Notice communication as part of your first-year placement. Understand how it occurs and appreciate its importance in the delivery of patient care.